But we begin with the CDC's response to the changing coronavirus pandemic. The CDC shortening the isolation period for asymptomatic people infected with COVID-19. The guidance is whether you are vaccinated or not. If you test positive for the virus, you should stay home for 5 days. If you have no symptoms after 5 days, you can leave your home but continue to wear a mask for another 5 days. The change comes after a recent surge in the Omicron variant, which is driving up COVID-19 cases nationwide, especially in children. The U.S. is averaging 260 pediatric COVID hospitalizations every day. That's up nearly 30% from just last week. And businesses are responding to the uptick in cases. Apple is closing about 20 of its stores, saying infections among employees have left the stores unsafe and understaffed. CBS News Debra Alfarone has more.
The CDC is shortening the amount of time people have to quarantine after getting COVID.
The data suggests that with Omicron, you're most infectious a day or two before you get sick and for the first day or two after you've gotten sick.
The new guidance allows asymptomatic patients to only isolate for 5 days instead of 10. They should continue to wear a mask for another 5 days around others, and a negative test is not required to end isolation. Some have criticized the decision to not require a negative test.
CDC makes guidance and recommendations in the real world, not the world that we wish existed. And right now, there aren't enough tests.
The airline industry pushed for the changes because it's having problems staffing flights. Several hundred more flights have been canceled today. But the head of the flight attendants union slammed the new guidance, saying if any business pressures a worker to return before they feel better, it will cause much greater disruption than any staffer shortages. Dr. Anthony Fauci, the White House's chief medical advisor, suggested over the weekend that vaccine mandates for airline passengers should be considered. He's now walking back those comments.
Right now, I don't think people should expect that we're going to have a requirement in domestic flights for people to be vaccinated.
Meanwhile, the CDC says it is actively investigating or observing 68 cruise ships following COVID-19 outbreaks on board. Debra Alfarone, CBS News, the White House.
For more on this, I want to bring in Dr. William Schaffner. He's a professor of medicine in the Division of Infectious Diseases at Vanderbilt University Medical Center. Dr. Schaffner, thanks so much for joining us. The decision to shorten the isolation period for everyone comes at a time where airlines and other industries have been short-staffed. There's a lot of skepticism, a lot of concern here. Does the science actually support this change, or was this a decision motivated by the needs of businesses and the economy, do you think?
Well, Scholar, I think it probably was a little bit of both, but it surely is science-based because you are most contagious for the day or two before you become ill, and then for the day or two after you have the start of your symptoms. So after about 5 days, if your symptoms are abating and you have no fever, then you can just put on the mask and go back out into society. That seems a reasonable balance, and certainly will help us here in the medical center get some folks back ready to take care of patients, never mind having folks out there in the airline industry and other places function better in the larger economy.
Now, while all of this is happening, people are concerned about their kids getting COVID. There's been about a 50% increase in new cases in kids since the beginning of December, and only about 13% of kids ages 5 to 11 are actually fully vaccinated. So, one, how can we encourage more parents to vaccinate their kids, and what safety precautions would you recommend to parents who are sending their kids back to school after the new year?
Well, for sure, this Omicron variant is so highly contagious, it's getting into all segments of our society, and that includes children. Fortunately, children are less apt to become ill than their parents or other adults, but nonetheless, if there's so much transmission among children, obviously, some of those children will become sick, some with underlying illnesses, some perfectly healthy children, and we're seeing an uptick in hospitalizations in our pediatric hospitals. Now, what can we do? Ask parents to speak with their family doctors and pediatricians. They will offer the very best advice. You don't have to listen to Bill. I'm urging those parents to vaccinate their children. Talk to your own doctor. They're there for you. They will be happy to give you the best advice.
You heard Dr. Fauci say the Biden administration is considering a vaccine requirement for domestic flights, but it's unlikely to happen. Do you think we're at the point where we need some of these added incentives to stop this Omicron spread, particularly with COVID?
Well, speaking for myself, I've been there for a while. I think if we have requirements, obligations, bad word, mandates for vaccination, that will help persuade, encourage, cajole some of our reluctant friends and neighbors to finally get the vaccine, join the rest of us, and help drive this COVID down.
The CDC estimates the Omicron variant is roughly 59% of coronavirus variants in the U.S. for the week ending on Christmas Day. So a question here, how has our knowledge of the variant changed over this short period of time? And based on what we know about Omicron, what can you predict right now about the possibility of, say, a future variant, or perhaps how deadly Omicron could perhaps be?
Skylar, you're asking the toughest question. I have to get out my cloudy crystal ball. COVID is so unpredictable. But let's just say, I would hope that Omicron will spread more widely and then begin to go down in the beginning of 2022. As to new variants, every variant of concern has cropped up internationally. And we need to remember, while we're trying to control COVID here at home, we also have to take a global perspective, because while there's transmission abroad, what happens there with a new variant can be here in no time.
All right, Dr. William Schaffner, we appreciate you coming on with us.
My pleasure.